If your period is delayed by more than 2 to 3 weeks after taking the morning after pill, it's important to rule out pregnancy and consult a healthcare professional.
But what would you think if your period hasn't come, say 3 or 4 weeks or even longer after you use the morning after pill and you're not pregnant?
The morning after pill is a popular form of emergency contraception. It helps prevent pregnancy after unprotected sex. While highly effective, it can sometimes cause puzzling but temporary changes to your menstrual cycle. One of the most common concerns is whether it can delay your period and by how much. In this video, we'll explore how the morning after pill affects your menstrual cycle, especially as it relates to your next menstrual period after taking the pill. We'll also consider the question, when should you consider seeking medical advice after taking the morning after pill? What's the longest delay women experience with their periods after taking the morning after pill? And is it normal? Most morning after pills contain high doses of synthetic or human-made hormones depending on the brand. The morning after pill works by delaying or preventing ovulation. This means that no egg is released by the ovary for fertilization. These actions can disrupt the usual hormone balance of your menstrual cycle, which is why period delays are a fairly common side effect after taking the morning after pill. The two most common types of morning after pills are levonorgestrel-based pills, for example, Plan B, Levonel, Postinor, and so on. These contain a synthetic or human-made progestin, that is a progesterone-like hormone. They're most effective when taken within 72 hours of unprotected sex. The next is the ulipristal acetate-based pill, also known as ELA. These pills modify or alter progesterone receptors. They can be used for up to 120 hours after unprotected sex. Both types can temporarily affect the hormone rhythm of your menstrual cycle. So they can do things like potentially delay your period or cause spotting after taking them. So now let's look at typical timeframes for periods after taking the morning after pill. There could be short or minor delays. In most cases, your period will arrive slightly earlier or within 7 days of its expected due date. But there could be longer delays. Some women experience delays of up to 2 weeks as a result of some of these hormone shifts we've talked about. And there could be no changes. For a smaller number of women, the pill does not significantly affect their cycle. So back to our question, what's the longest delay women experience with their period after taking the morning after pill? And is it normal? A small number of women have experienced delays of over 2 weeks, some even going to not seeing their periods for 2 to 3 months after taking the pill and in the absence of pregnancy. That isn't typical or normal, so it's always important to see your doctor if that happens. Your doctor can get more details about your medical background, the circumstances around you taking the pill, and run tests to detect any problem. Sometimes after this period of time, the period resumes and no abnormality is detected. We've established that delayed periods are common after using emergency contraception like the morning after pill. However, you should pay attention to the following. A risk of pregnancy despite taking the pill. So if you don't get your period within 2 to 3 weeks of taking the pill, do a pregnancy test. Next, unusual symptom. Having severe abdominal or pelvic pain, experiencing irregular heavy vaginal bleeding, or other symptoms may indicate underlying issues. Next, experiencing irregular cycles. If your periods remain irregular, for example, spotting going on 2 to 3 months after using the morning after pill, seek medical advice to rule out forms of hormonal imbalance or other conditions that may be responsible. Experiencing a delayed period after using the morning after pill can be very alarming, but there are a few things that you can do if your period doesn't turn up when it's expected. First, do a pregnancy test. This is the first step if your period happens to be more than 7 to 14 days late. Next, track your cycle. Clearly, you should be doing this already, but use an app or diary on your phone to monitor when your period starts and ends and anything unusual in between. These dates are usually a good indication of how your menstrual cycle is behaving, but bear in mind they are estimates and sometimes they could change, especially if you don't ovulate at the same time every month. This can happen from time to time as a result of stress, illness, taking medication, and so on. Of course, the other thing is getting medical advice. Are you experiencing prolonged delays or unusual symptoms? Avoid guessing or agonizing by speaking to your doctor promptly. There are several birth control methods available today. Have a chat with your doctor or nurse about the option that will be most suitable for you. The morning after pill is a reliable method of emergency contraception. However, it can temporarily disrupt your menstrual cycle. This can result in several changes such as a delayed period. Most of these delays are minor and they resolve on their own within a few days or weeks. However, if your period is significantly late or you experience unusual symptoms, please don't hesitate to speak to your doctor. Check out this video here to learn more about birth control options, and I'll see you again soon.